Many of you may be asking, why should my health system adopt Toyota Production System, or Lean? Why should I take this course? To begin to answer this question, let's first review Toyota's record of achievement in the automobile industry. I reviewed Toyota's accomplishments in our first course during week 2, but I believe it is important to review them again. After all, repetition is the key to learning. In the 1990s, when consumer organizations looked at the quality of cars from different manufacturers, they concluded the initial quality of Toyota was 20% higher than average. Using a dependability index, they also determined that Toyota dependability was 22% above average. Consumer Reports noted that an 8-year-old Toyota was equivalent in reliability to a 3-year-old Ford or Chrysler and to a 2-year-old VW. In the first course, I also discussed the financial models of General Motors, Ford, and the other American automobile manufacturers as compared to Toyota. General Motors subscribed to a push model. They batch manufactured. They manufactured large numbers of one model and color of a car at one time. For example, they would make 10,000 blue Malibu sedans. From an operational standpoint, this allowed them to use the same exact processes and paint color over and over again. However, there was one problem: the customer. Customers had not been asking for blue Malibu sedans. So how did GM convince customers to buy them? GM advertised major promotions offering large discounts on their blue Malibu model to artificially increase demand. They pushed the blue Malibu onto the customer. In good financial times, this worked. However, when the economy tightened and car buyers became more cautious, this strategy failed, and General Motors went bankrupt, requiring a government bailout. Toyota, on the other hand, did not push on their customers, but rather only manufactured the cars that the customer had ordered. In other words, the preference and needs of the car buyer pulled the manufacturing of a specific color and model car. For example, if a car buyer ordered a red Camry, the frame of the Camry was placed on the assembly line along with the parts and paint using a highly efficient, just-in-time supply system. They manufactured exactly the cars the customer desired. As a consequence, during the great economic downturn, Toyota became the #1 car manufacturer in the world. As I discussed in the first course, just like General Motors, physicians too often perform tests and procedures that are unnecessary and have no proven benefit. They push expensive tests and procedures on their patients. But unlike General Motors, they do not have to create promotions or offer discounts. They simply tell patients that they require the test or procedure. By following the principles of Toyota health systems throughout the world can change their model and begin to provide only the services that are of value to patients. In other words, the needs of patients will pull the proper diagnostic tests and therapeutic interventions. Throughout its existence, Toyota has focused on value. Remember, value equals quality divided by cost. They continually remove waste to improve efficiency and to reduce cost, and continually improve quality by creating better assembly and painting protocols. Some claim that TPS or Lean can only work in Japan. However, the fundamental principles of this system were originally brought to Japan by an American, W. Edward Deming, and many of the principles were first applied by Henry Ford. Furthermore, TPS has been successfully implemented in Toyota of North America, and the quality and reliability of their cars are equivalent to Toyota cars manufactured in Japan. Today, nearly all automobile manufacturers apply TPS to manufacture their automobiles. When I ask students about cars that were called lemons, many look at me with a bewildered expression, because when it comes to new cars, lemons are now very rare. For those who are not familiar with the term, it refers to a newly manufactured car that contains multiple defects that are experienced by the owner immediately after the car is purchased. In the 1960s and 70s, lemons were so common that in the U.S., lemon laws were passed in every state declaring that if a car was defective at the time of purchase, the car manufacturer was obligated to take it back and provide a full refund. We can thank the adoption of TPS by the automobile industry for the disappearance of lemons. What are healthcare's lemons? Deaths and injuries from preventable medical errors. If our health systems adopted TPS or lean, patient harm would disappear. Some warn not to use Toyota analogies because physicians don't like them. And I can speak from experience, this has been an issue. However, we can all learn from successful industries. Of course, patients are not cars, and the complexity of patient care and health systems is greater than car manufacturing. But TPS can and has been adapted to healthcare with exciting results. Everyone in healthcare agrees that waste is a major issue in healthcare. Expenditures for healthcare are now approaching 20% of the United States gross domestic product, and healthcare costs nearly $10,000 per capita. In other countries, the costs are less than half of what the U.S. is paying. However, healthcare represents a major expenditure in every nation in the world, and every country can eliminate healthcare waste. Practitioners of TPS continue to ask, is this of value to my patient? And the answer to this question allows them to dramatically reduce waste. When applied to healthcare, can TPS achieve the same goals as the auto industry? The answer is clearly yes. Let me share two exciting examples. First, Virginia Mason Medical Center, who adopted TPS beginning in 2001. In 2010, it was designated the Hospital of the Decade by Leapfrog. From 2002 to 2014, their liability premiums dropped by 60%. Patient satisfaction is now in the top 15%. In 1998 and 1999, just prior to adopting TPS, they were losing money. In 2012, after 10 years of implementing lean, they had a 3% positive margin, $30 million net earnings out of $934 million operating budget. Secondly, let me introduce you to Denver Health. They adopted TPS in 2004, and in 2011, Denver Health received the Shingo Prize Bronze Medallion for Operational Excellence, becoming the first healthcare delivery organization to become a recipient. In 2012, they received the Peak Award, the regional equivalent of the prestigious Malcolm Baldrige Quality Award that recognizes organizations that achieve and sustain the highest national levels of patient safety and loyalty, patient outcomes, physician and staff satisfaction, revenue and market share, and community services. One important measure of the quality of their care is their 0.5 observed expected mortality, one of the lowest in the nation. Finally, they documented savings of greater than $200 million over 7 years. Most systems, as Don Berwick says, the founder of the and former CEO of the Institute of Healthcare Improvement, put it, nibbling around the edges. Too often, quality improvement is piecemeal, and improvement in one location fails to spread to others. And these improvements are not sustainable. Once the champion leaves, the improvement disappears. Most health systems do not have a broad, systematic approach that assures standardized work throughout the system. TPS or lean provides an overall system that achieves continual and sustainable change. TPS is transformational. Thank you.